Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I'm your co-host, Dr. Eryn Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And in today's podcast, we are discussing the labs that you should avoid at all costs. And this is basically like a continuation of our discussion that we had last week, where we talked about the labs that you should definitely get and monitor. But once again, I'll be guiding this discussion, and Dr. Eryn is going to be doing the deeper dive into the specific labs and why she says to avoid them. So, Dr. Eryn, are you ready?
I'm ready.
All right, cool. So you sent me the list of labs that you wanted to say this is what we should avoid. And the first one is the Dutch lab, or Dutch testing, which is basically a dried urine test for comprehensive hormones. And this came about as a method for assessing hormone levels in the body, right? It involves collecting dried urine samples, and you do that over 24 hours. And then you analyze those samples for various hormones, metabolites, and other markers that they say it's testing. The primary goal of this Dutch testing is to try to provide a a comprehensive picture of hormone levels, once again, their metabolites, which can offer some insights into hormone balance, metabolism, and overall health. So I know this is pretty big right now, especially with all the functional health practitioners and integrated medicine providers. But can you briefly explain why, or can you just briefly explain your apprehension with this Dutch testing, testing? It's hard to say. Dutch testing.
So one, it's not a clinically indicated test. In other words, there's no established guidelines for even clinicians to interpret the complex test results. And then there's basically the reference ranges that they use aren't validated. So there haven't been enough studies done on this just to begin with, right? Just at the surface. So another issue is that you're using urine testing instead of the gold standard in most of the testing, except for cortisol. Cortisol sometimes is tested with a urine test, but for the most part, the gold standard to test some of these blood levels would be blood, not urine.
Yeah.
So there's a number of factors that could interfere as well. But in general, if you go to a physician, they are not going to read these tests because they are not clinically validated.
Yeah. And so why don't you break down for our audience why dried urine samples aren't widely used, especially for hormone testing in regular medicine practice, medical practice?
Well, for one, we have better levels with blood testing, right? I only am familiar with this test because you actually had it done, and I looked at the results, and they look very pretty, right? There's a lot of graphs, and there's a lot of explanation. And I will say that, when I looked to see what kind of laboratory standards they have, the company that produces the Dutch test is CLIA certified, but that does not necessarily mean that a consumer, that the lab reference ranges are clinically validated. So just because something might be approved and their laboratory settings are clean, with the CLIA certification doesn't mean that these are clinically indicated. So again, we have better results with blood, except for occasionally cortisol will measure in the urine clinically. And if you think about this testing, it is a consumer product. So it's a lab to consumer product. So it's not given with the intention to go through a provider, which I think is very dangerous because it's a complex test that's difficult to even make heads or tails of. And so, which goes to their marketing scheme, right? Because then you have to get one of their providers to explain what's going on here. But because there's no quality control. So, right, you can have misleading results depending on external factors like contamination, degradation, improper collection methods. And spot urine samples in general do not reflect accurate hormone levels in the blood.
So you just touched a little bit on it, but what are the risks involved using, dried urine samples, and why is it so important to collect them properly?
Well, I don't recommend them at all. So I don't think that you can make any kind of clinical decision based on a urine sample when you have better blood levels of most of these hormones, except for, like I said, you can get a cortisol, a 24-hour urinary cortisol
Okay.
level
Well,
that
so
is
yeah,
used clinically.
so basically it's just because we could get better readings in blood, you wouldn't waste your time. So basically you're not wasting your
Correct.
money on a Dutch test. Is that what you're implying?
Yes. And
Yeah.
I
They're
will
expensive.
put, yeah, I was just going to say they're really, really expensive and a waste of money, in my
Yeah.
opinion. And I smiled when you first started talking about functional health providers and integrative medicine people. A lot of the reason that they point you to a test like this is because they're trying to find the root cause of some issue that you're having. And my question would be, one, in a clinically unvalidated test where you can't even trust the reference ranges, if you do find an abnormality in some small hormone, what do you do with that? Um,
Yeah.
so, what do you even do with that clinical information?
Well, they
I'm
got
not even certain about that.
they got supplements for every
Yeah,
thing
exactly.
that's on. Yeah.
Exactly.
All right, let's
So,
go. Let's go on to the next one. Because this one I feel like this is very, very relative in our field. Because the thyroid deals directly with your metabolism, and a lot of people are always trying to lose weight and better their body composition. And we're in this era of, all of these wellness trends that's hitting the market, and a lot of the self-care movements. Um, so testing the thyroid might actually seem like something to where it's like proactive, right? We talked about last week how it's not always ordered unless it needs to be ordered. But people are asking for it more often to maybe seem like it's proactive. But most people self-diagnose themselves and they believe they have thyroid issues based on vague symptoms, or they're actually just looking for a reason for why they can't lose weight. It's not that they can't follow a diet or a deficit. It's got to be their thyroid, and that's they want to feel like they want there to be something wrong so they can blame something. And now, like we just mentioned, we have this spike in this alternative health practice, and followers of these practices are going to feel like those providers are advocating for the regular testing of the thyroid. And this is going to be a better approach, to your overall wellness, despite the lack of clinical evidence that supports the necessity of continuously testing without symptoms, right? So I'm going to be honest. When you first gave me the list, one of these two that I'm going to name, it was pretty much a surprise to me, as well as I think it's going to be for the rest of the audience. And that was being T3, and how you're saying to avoid that. And then also one which isn't a surprise at all is reverse T3. It might be a surprise to some people, especially those who follow functional people. But T3 and reverse T3 are the two. So why don't you explain to our audience why you think that those two thyroid tests are pretty much a waste of time?
all right. So let's just talk about the regulation of thyroid hormone. I think, we see a lot of videos on social media and stuff like that that are break it down simply. I will say that thyroid hormone conversion, transport, and action is quite complex. So anybody who's trying to dumb it down for you is really doesn't understand the whole clinical picture, I don't think. So T3 and RT3, let me cover T3 first. So T3 levels are variable because there is peripheral conversion at a tissue level. So in other words, the T3 blood level that you might get isn't necessarily reflective of your total T3. And so if somebody's blaming pathology on just a T3 level, that is misinformation, in my opinion. Most clinicians will start with your clinical picture. So your symptoms that you present with, and then they will assess whether they want to check your thyroid. And usually they'll just get a TSH level, and occasionally they'll get a T4 level. If you've had your thyroid removed, then a measure of T3 might be important. But besides that, there's not a real clinical indication to get a T3 level because it's really an unreliable level, essentially.
Mhm.
And it has a shorter half-life than T4. And then the other one that I hate, it's my pet peeve, is reverse T3. This is not used in conventional medicine unless you're critically ill. And by that, I mean you're in the ICU. And it's usually done for very complex presentations of, central hypothyroidism or a non-thyroidal illness that in a critically ill patient, essentially. So, this is not something that is routinely ordered. It doesn't tell you if a patient is, if the level comes back abnormal. It doesn't really tell us much about your thyroid function necessarily, unless you are critically ill.
So the T3 levels, which they get, and it's basically just a snapshot in time. It has variability due to the fact that it can be produced by other tissues. Is that what you're saying?
Correct. Yeah.
Okay.
So you got to think of the tissues with a lot of blood flow. So like your liver and kidney are going to be the main ones that I would think of right off the bat. So again, it's not going to be reflective of an
Mhm.
accurate level in your body.
Yeah. So and so if they're not looking for that stuff, you mentioned something about TSH. Is that mainly what the doctors are going to use?
Yeah, so to diagnose a thyroid issue, typically TSH is used to see if it's high or low, and that then gives us a little bit more information on whether you're hypo or hyperthyroid. And then again, like I said, you put that together with the clinical picture, and then there might be further investigation
Yeah.
as far as which route you go.
Yeah, and if you are listening and you want to listen a little bit more on the TSH and T4, we touched on that in last week's episode on why you should get it if you need it. All right, let's
Yeah.
go to the next one that you had. And this one I find to be pretty cool. I kind of like the idea of it, but also I can't wait for you to explain why you should avoid this. And it's probably because of the dried urine. But anyway, cortisol. All right, so cortisol in our body, it follows this natural daily rhythm known as the circadian rhythm. And typically, cortisol levels are at its highest right in the morning, like right after you wake up. So it's kind of like starting your car and revving the engine, right? It's getting things moving, and you're pressing on the gas pedal. It's getting things moving. It's that surge of cortisol gives us a nice boost of energy, just getting you ready to hit that road, right? And then as the day progresses, cortisol levels should gradually decline, reaching the lowest point around when you're going to sleep. And this decrease in cortisol, it actually allows the body to rest and recover during the night. So throughout the day, might have, you might have some ups and downs with cortisol levels. But that's really just in response to, like, if a car was driving, there's different road conditions, right? So if you encounter a traffic jam, that might be some stress. Or if you take a detour, it's like maybe you're doing exercise, and that's going to change the level of cortisol going throughout your body. Um, but however, the overall pattern of cortisol, it remains very consistent. So with that being said, why does this natural rhythm matter for this type of cortisol testing? Number one. Number two, why you say don't waste your time?
Well, unless, again, clinical picture becomes very important here. So unless you're going to an endocrinologist and you have a clinical picture that's like something consistent with Cushing syndrome, for example, um, then you have to have that clinical suspicion in order to kind of go down that rabbit hole. So let's say you get a cortisol level on a random normal person, i.e., no symptoms.
Mhm.
You just get it as part of their lab panel. Um, the typically it's going to be in the normal range. What does that tell you? Nothing, really
Hmm.
nothing, because the concentrations, again, as you referred to, vary from early morning to the afternoon, and usually they're lowest 1 hour after you go to sleep. And so because the normal ranges are so broad, the clinical information that you get from that is limited unless there's pathology,
Yeah.
i.e. Cushing syndrome.
Hmm.
And occasionally, you will get a random, cortisol level, and you might get lucky and see that somebody might have symptoms that are consistent with Cushing syndrome. And then there's an array of testing that is done after that clinical suspicion is kind of seen, I guess. And to be fair, cortisol can be measured with a 24-hour urine. Typically, to diagnose some pathology, you want two 24-hour urines. But then there's blood testing that can be done in addition to that. And you'll probably look at plasma ACTH, which is precursor to cortisol. So there's a lot more involvement if you actually suspect pathology. But again, you should be going to an endocrinologist if that's the case.
Hmm.
Um, Not, if some random person says we need to get a serum cortisol level, I would ask them why. Do they suspect Cushing syndrome, or are they just kind of getting it to make sure that it's in that normal range? And really, what is the clinical significance of that normal range?
Yeah, what are they going to do if it's not in the normal range? Like, if they're not an endocrinologist, why even messing around with that stuff? But it's funny and it's very relevant too, because a lot of people, and I'm going to just say anecdotally, it's mainly women, and some of the clients that we've dealt with were mainly women who bring this to our attention, to where they feel like their cortisol levels are elevated, and it's because of this, and they say these symptoms that they're relating to cortisol levels, and they want to go get it tested. But cortisol in the body, it's needed. We want cortisol in the body. We just don't want it elevated all the time. Um, so, what are some health factors that can affect cortisol levels in the body? If you could touch on a few.
Really, if it's high, it's pathological, and that would be Cushing syndrome. And there's either exogenous or endogenous. So either you're taking some kind of steroid, or your body is producing it. And so either you have a pituitary adenoma, which is essentially a pituitary tumor that's overactive, but there's typically two ways to get that. So you're not a high normal range is a normal range, period.
Okay, so but what are there anything that like for example, stress, right? Stress can increase it. Working out can increase it. Is there any other
Yeah,
type of
these
things
are
that?
these are momentary increases,
Yes,
right?
yes,
Again,
yes.
broad range, physiologic stress essentially would increase a cortisol level depending on when you measure it. But again, broad range, it's going to fall within a normal range. It's never going to be abnormal unless you have pathology.
See, it's cool that you answered it that way, because like you could see where your mindset is, and it's very like in the clinical, to where like I'm trying to bring in and try to like throw you out of that clinical picture for a second and just be like, well, there's going to be ebb and flow between increase and decrease, right? And some things like you said, exogenous stress is definitely going to increase it momentarily, right? It's still going to stay within the range, but you might get a bump, right? You might get a bump in the road. And something like meditation or going for a walk in nature might actually help bring it down. So those are a few things that can have an effect on overall cortisol throughout the day, but it's going to stay pretty consistent to where you want to have the rise in the morning, the fall at night, and there's going to be a broad range to stay within. And if unless you're out of that range for a period of time, I'm guessing, this is what I'm going to ask you next, is when you really got to be concerned. So, when might a doctor recommend further testing on cortisol levels because it's showing those types of signs to do so?
So again, I would encourage anyone that actually suspects an issue like this to go to an endocrinologist, but very non-specific findings. And it varies depending on the age. The classic ones we learn in medical school are, central obesity, stretch marks, striae, and usually they're pretty significant stretch marks. And but some other things that especially in younger patients to consider is besides central weight gain is early onset hypertension with no unknown etiology, hyperglycemia. If a young person has osteoporosis, it is on the differential diagnosis. And by what I mean by that is the list of possibilities that somebody might have. Again, it is a very difficult clinical picture. It's not straightforward. The ranges of clinical presentation are very nonspecific. And so it's not out of the realm to get a cortisol level. But I would make sure that if you do suspect an issue with cortisol, that you're actually going to somebody who can interpret that data and do the appropriate follow-up testing to make sure that that's what they're looking at.
Yeah, do your due diligence. If you have a coach, like I label myself as a coach, if I tell one of my clients, go get, cortisol levels checked or whatever, follow up with an endocrinologist, not the coach, right? Not a nutritionist, an endocrinologist, right? Not your pediatrician. Like go or family doctor, go to a specialist, and that specialist is going to be an endocrinologist. So make sure when you're dealing with hormones, that's who you talk to. They know better than anyone, hence their training. So let's go into the last one that you sent me. And this one, I love that you brought this up because if you didn't, I was going to bring it up. But it's IgG testing for allergies. And this one really, really hits home for me because when I first started coaching, a lot of clients would ask about this and they would say, like, I think I'm allergic to certain foods. I think I have a sensitivity. I think I have an intolerance. And I told them to stay away from this IgG testing because it's not telling you what you're intolerant to or sensitive to or allergic to. It's telling you what you eat most often because it's basically just measuring this IgG, which are antibodies formed by your body basically saying like, hey, I have to formulate this antibody against it because it's coming in so often. That's all it is, right? So you're getting a test done. It's going to tell you to stay away from your favorite foods, the ones that you eat most often. And that kind of just grinds my gears because it's expensive tests and people waste their money on it. And they're like, oh, one of our clients did it, won't say his name, but we literally had to go on like, there was like 4 foods he could choose from. And we did it for like 2 weeks just because it alleviated his mind, right? He was just like, well, let's just do it. Let's just try it. Nothing happened, right? If anything, he was just pissed that he wasted 2 weeks because he was like, I can't do this anymore. This is miserable. And we basically took his food that he was eating and said he was allergic to, put it back in, and he just felt the same. There were no symptoms. So yeah, it just really, really grinds my gears.
Well, I think it's important to differentiate, right? An allergy, what is a true allergy versus a sensitivity or a food group that you might not agree with.
Okay, so an
Um,
allergy would be something like where your immune system reacts to a substance, mainly a protein, and it causes a reaction. And some of these reactions, for example, could be like hives or your throat starts to close. That would be like an allergy. An intolerance would be it's not an immune system reaction at all, but you're actually having trouble digesting the foods. Like there's a lack of an enzyme. So, for example, lactose intolerance, you basically lack the the lactase enzyme. So if you take something like Lactaid that actually has a lactase enzyme in it, it helps you digest lactose. And then you have sensitivity, which there's no standard medical definition for sensitivity. It's not recognized in the medical community at all. And there's no evidence to support that there is any specific sensitivity test that you could take. Because these tests, especially this IgG, it's saying that they detect a sensitivity, but the sensitivity that stuff doesn't exist. So now it's like now they're like trying to find ways to like get people to buy it, and now like gut health is a big thing. So they're like it's saying, oh well, if you test, you'll be able to find out what's giving you that bloating or that indigestion and stuff like that. So one important distinction that I made earlier was that these tests detect IgG and not IgE. So Dr. Eryn, being the medical expert here, one, can you explain the difference between both of those? And two, how do doctors diagnose food allergies when basically looking at the IgE and the role it plays in that?
All right, so I'll premise what I'm going to say with, if you suspect you actually have a food allergy, you should go see either an allergist, um, a gastroenterologist, or again, sometimes you can start with the endocrinologist, but eventually they'll probably send you to an allergist. So let's talk about IgG antibodies for a minute. So
Mhm.
IgG antibodies have a long half-life. They are not specific for allergy testing. Allergy testing typically is a type 1 reaction, which means it's an immune-mediated allergic reaction, which, as you mentioned, you get hives or your throat closes, and it can be dangerous, right? Um, and IgE is more specific in this case to diagnose a type 1 hypersensitivity reaction. So I'm going to switch back to IgG for a minute.
Mhm.
IgG, if you measure it and you're looking at specific foods, it can be a physiologic response of the immune system to exposure to any food.
Mhm.
Okay. So that means that if you have a reaction, there is no pathology necessarily, right? It's just that your immune system is reacting to that food, period.
Mhm.
And IgG testing, I will also say, is not recommended by any American allergy and immunology societies to make a diagnosis of food allergy. A food allergy is diagnosed with IgE
Mhm.
testing typically. So some provider is saying, let's try to do IgG testing on you. They're trying to send you down a rabbit hole that is not clinically indicated. Again, if you go to an allergist, they're typically going to test for IgE antibodies, and they have a high affinity receptors on the surface of mast cells and basophils, which triggers those allergic reactions, right? So those
Yep.
inflammatory mediators like histamine, which causes hives or plays a role in hives. So that's what you're looking for. So your first red flag, if somebody is trying to test a food allergy, if they send you for IgG testing, I would question the provider.
Yeah, 100%. So going back to the two questions that I asked, how do doctors diagnose food allergies?
So typically they'll do an allergen exposure and then measure the IgE levels,
Mhm.
and that's done various ways. But they'll see what kind of reaction you have. Usually, they can do that on the skin sometimes, because even a small amount of the allergen, if you do have an immune response and you have IgE levels, you'll respond. Um, either with hives or some other allergic response.
Yeah, that's where they like pin the skin, right, with the allergy and see if
Yeah.
it bubbles. Yeah, yeah.
Yeah.
So we talked, you touched a lot on how you need to avoid this type of testing because it can lead you down rabbit holes. What are some, let's say someone does it and someone goes through it and they believe in it. What are some of the risks with that alone?
Well, I think it's your quality of life, right? Like, first of all, it's not clinically indicated. And then if the providers says something about the reaction of your IgG testing, they're going to tell you all these foods to avoid.
Yeah.
And there's no real reason to avoid those foods. It's just that you commonly have seen that pathogen, and therefore your IgG levels might show a higher level because you actually have that food in your diet.
Yeah, and just for everybody, like your immune system's made to have when stuff comes into your body that's from the outside, it's supposed to detect it, right? That means it's a good functioning immune system. So these IgGs, it's normal. And so when you go get this test and it shows you that everything that you normally have been eating is that you're reacting to. Yeah, you're supposed to react to it. It's a good thing. Your immune system's supposed to work that way. Doesn't mean that you're going to have a reaction or that it's causing the bloating or the water retention or the distension in your gut. So I'm glad we
Also,
touched on
I will also say that if a provider is saying IgG4 test, that's also not clinically indicated. So if you think that's like some better special test for IgG, it's just a different measure of your immune system. Again, it's IgG. it's not clinically indicated for this kind of for testing for food allergies.
Now, I know this is not your specialty, but and I'm not sure how much you've been around it, but what kind of tests are there done? Like I know we mentioned like the skin prick test. Is there anything else done to where like let's say someone does go and they want an allergy test and they forget the names, but they know like what's physically being done to help them get a better understanding of like, oh, this doctor actually cares and knows knows what they're talking about.
Yeah, so there are lab testing for IgE again, and there's immunoassays for specific IgE, but the clinical picture has to be there as well. So the first step is determining if somebody actually has an allergy. So that's not my stomach gets upset
Yeah,
because, sometimes I eat corn, for
yeah,
example.
yeah,
So an actual allergy, as we described, is a type 1 reaction where you can get, hives and some more life-threatening things like your airways swelling.
yeah.
And so then there are laboratory testings. Again, the skin testing is one way, but there's different immunoassays depending on the clinical presentation.
Yeah, and this kind of just brings up another point, which is like everyone's like get away from gluten, and gluten's not inherently bad at all, unless you are intolerant or sensitive to it or have the allergy to it. Right now, if you have celiacs, it's extremely important. And Dr. And I know you touched on this in one of the previous podcasts. You need to stay away from it without a doubt. Right, like if you have celiac, stay away from gluten. Now, if you take gluten out of your diet because you think it's healthier when it's not, but you feel better, then keep doing that because who knows, you might be a little sensitive to it, right? And it just makes you feel better. That's fine. Even psychologically, if you just feel better not eating it, okay, but you don't have to take it out of your diet if there is no actual allergy to it. And I just needed to say that because it's a huge thing, especially now with everyone going gluten-free. So
Yeah, typically if you do have celiac disease, you're going to know it. And there is a lot of precautions. It's life-changing, right? You can't go to a restaurant and cross-contaminate with gluten. So it is a very serious health issue for the people that do have that disease state.
yeah, it's almost like a slap in the face for those people that do have celiac disease because of how big of a lifestyle change you have to make. Like you, it's extremely difficult to try to have a quality of life, especially when you look at like, the westernized type of civilization where, going out to eat is a luxury, right? It's enjoyable. People want to do it. It's a social event, right? It's a slap in the face when you say I'm refraining from gluten because I'm intolerant or sensitive to it when you don't have celiacs. Because it's like you don't there's two different extreme ends of the spectrum there. It's like one is like totally change your quality of life. The other one's just like I'm gonna avoid it because I think it's healthier. So that's just another way to look at it, another perception.
Yes.
But yeah, that's all we got for you today. We went through what was it, 4 tests that you should avoid at all costs. And if you missed our first episode about the test that you should take, make sure you go listen to it. It was episode 25. It was last week. This is episode 26. Dr. Eryn, thanks for diving deep and giving the knowledge that you have in that little brain or in that big brain of yours.
You're welcome.
So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.